In this video, we're going to be talking about cardiac output. We're going to discuss what it is, the physiological adaptations that take place when we improve cardiac output, as well as its importance as it relates to sports performance and athletics. So first, let's define cardiac output. Cardiac output is simply the heart rate times the stroke volume, and it generally refers to the amount of blood pumped per minute, and it's expressed in units of liters per minute. So cardiac output is a rate. Now, on average, the total amount of blood pumped out of the left ventricle, whether they be trained or sedentary, is approximately 5 liters of blood per minute. However, the resting heart rate of a sedentary individual on average may be, let's say, 70 beats per minute, whereas a trained individual may exhibit a resting heart rate of approximately 50 beats per minute or lower. However, the cardiac output stays the same at rest. So where does the difference lie? The difference lies in the stroke volume, or the amount of blood pumped per beat. So as we can see here, in a sedentary individual at rest, they may be pumping out 71 milliliters of blood per beat in order to maintain a cardiac output of 5 liters of blood. Their average heart rate is 70 beats per minute. Now, in a trained individual, if they exhibit an average resting heart rate of 50 beats per minute, to maintain a cardiac output of 5 liters of blood per minute, that would equate to 100 milliliters of blood per beat, right? So the efficiency in trained athletes compared to untrained athletes lies in their ability to pump more blood per beat, or they have a more efficient stroke volume, right? Now, this last example was at rest, right? Now, at maximal exercise, it should be noted that maximal heart rate is generally the same within age groups. Now, there's various equations that you can utilize in order to determine maximal heart rate, but one equation that you can use that isn't particularly accurate, but it can be utilized to make a generalization of maximal heart rate, is 220 minus the person's age. So let's say that we have 2 individuals that are 20 years old. Individual 1 is untrained, individual 2 is trained. So their maximal heart rate is approximately 200 beats per minute, okay? Now, stroke volume of the untrained individual is about 100 milliliters of blood per beat, whereas the stroke volume, or the amount of blood pumped per beat in the trained individual, can be up to 200 milliliters per beat. So that is a 2x difference. 20 liters of blood pumped per minute compared to 40 liters of blood pumped per minute, okay? So therefore, and I repeat, the significant differences in cardiac output can be attributed to increases in adaptations associated with stroke volume. Now, I mentioned that stroke volume is the amount of blood pumped per beat, or a more intellectual definition can just be the difference between the end diastolic volume and the end systolic volume, okay? So what does that mean? We can look at our heart diagram here. We have our right atria, our left atria, our right ventricle, and our left ventricle. Now, the end diastolic volume is the amount of blood that is within the right and left ventricle before systole, right? So when the right and left atria contract together, they fill the right and left ventricles with blood. So that is diastole. And then when the right and left ventricles contract, that is systole. Okay? So the amount of blood left over after systole is our end systolic volume, correct? So the stroke volume, again, is the difference between the two, okay? So let's talk about some different variables that are associated with an enhanced stroke volume. First, we need to mention the Frank-Starling mechanism, which is more of a passive mechanism, but it needs to be included nonetheless. So, a 30 to 50% increase in the stroke volume is due to a greater amount of blood returning to the heart at the onset of exercise. Okay? So we know as we start exercising, more blood is going to be circulating through the musculature as opposed to our internal organs, right? So with more blood being pumped through the musculature, more blood is going to be coming up into the heart, right? So for every action, we know that we have an equal and opposite reaction, right? So if our action is more blood returning to the heart, then the reaction is going to be an increased contraction of the ventricles in systole, okay? Leading to more blood going through systemic circulation, okay? Now, another variable that we need to mention is an increased eccentric hypertrophy, okay? Which is a physiological adaptation resulting in an increased chamber diameter of the left ventricle, okay? So, as we become more physically fit, and this just relates to endurance exercise, it can also relate to other various things such as resistance training, okay? We're gonna have an increased diameter of the left ventricle, right? That is going to allow more blood to come into the left ventricle during diastole. So if we have more blood in the left ventricle during diastole, that is going to equate to a more forceful contraction during systole. More blood is going to be pumped through the systemic circulation, right? So I also want to note eccentric hypertrophy, so think length, it's increasing the chamber diameter of the left ventricle. As it relates to resistance training, this term can be substituted for concentric hypertrophy. Concentric hypertrophy is primarily the thickening of the myocardium, okay, which is the muscle of the heart, right? So endurance exercise relates to an increased chamber, whereas resistance exercise enhances concentric hypertrophy, or the thickening of the musculature wall of the heart, the myocardium. Now, we can also see improvements in the ejection fraction, which is the stroke volume divided by the end diastolic volume. Now, I'm going to utilize arbitrary numbers. Let's say our end diastolic volume is 100 milliliters of blood, and our stroke volume, or the amount of blood pumped out of the left ventricle, is 60 milliliters of blood. This can be slightly enhanced through the physiological adaptations that come from endurance exercise. So we can have an enhanced ejection fraction. More blood will be pumped out of the left ventricle per beat. Again, it is more efficient, right? If we have an enhanced or an improved ejection fraction. Now, we also want to note that an enhanced sympathetic response during exercise increases the relaxation during diastole. So this enables the left ventricle to open up a little bit more, right? Allowing more blood to come into those chambers, again, resulting in a more efficient contraction of the heart, okay? Now, this also relates to this statement here. Blood naturally flows from a high pressure gradient to a low pressure gradient, right? That makes sense as it relates to Boyle's law, right? Because we know pressure is inversely proportional to the volume, okay? So, as volume increases, that means the pressure is going to decrease, right? If the pressure decreases, we're going from a higher pressure gradient, let's say in our atria when they contract, to a lower pressure gradient right, in the ventricles as they begin to expand. Okay? Now, let's mention two brief variables as it relates to the importance of an improved and enhanced cardiac output. First, a higher cardiac output increases blood flow to the working muscles. Okay, so we're going to have a greater O2 utilization, okay, a greater percentage or more oxygen being unloaded from the hemoglobin to the muscles, right? Better waste product removal, right? So that can relate to carbon dioxide being substituted for oxygen, right? And we know carbon dioxide is a byproduct of cellular metabolism, as well as greater nutrient transport, right? We obviously know that macromolecules, proteins, lipids, and carbohydrates, as well as various ions, are transported through the blood into the tissues. So a higher cardiac output is going to result in these three enhancements, okay? And an increased cardiac output can decrease RPE, or rate of perceived exertion, at higher intensities because the heart won't have to compensate as much through an increased heart rate.